Hi, today we're going to talk about the diabetes knowledge test that many of you have done in the clinic already and go over the answers to see how you've done. The first question is the body needs insulin to use the sugar people eat. And the correct answer is yes. Even diabetes people can either not use the insulin effectively that they have or their body doesn't produce it. That's why we use the different medicines to help your body use insulin and keep your sugar where it needs to be. The next question, when someone has diabetes, their children are more likely to get diabetes. And that answer is yes. There is a link to type 2 diabetes and the genetic component as well as type 1, but they actually say there's a stronger link between type 2 diabetes and genetics. A fasting blood glucose level of 100 is too low. And that answer is no. A fasting blood glucose level of 100 is actually very good. People with high sugar have trouble with blood circulation in their legs. And that is yes. Because diabetes can cause a lot of damage to the vessels, sometimes it makes you not able to heal as well. And you can have sores and things on your legs and a lot of swelling. And it makes it more difficult to have good circulation. People with high glucose can have damage to the kidneys. That kind of goes along with the last question. The little damage to the vessels in your kidneys, your eyes, can cause you to have kidney problems and not function as well. It can also cause the neuropathy, the numbness and tingling in your legs, and the vision problems. Shaking and sweating are signs of high glucose. And that answer is no. Shaking and sweating are usually signs that your blood glucose is low. And if you have those, you should check it and get you a snack or something to eat. It is safe for people with diabetes to wear flip flops. They say no, but I think it really depends. If you have feeling in your feet and you're checking your feet to make sure you don't have any wounds or cuts or scratches, wearing flip flops are fine. But I think they say it's not safe because if you do not have feeling in your feet, you're more likely to have some injury since your shoes are basically open. Vaccines are highly recommended for people with diabetes. And that is yes. People with diabetes are more prone to get infections that can be more serious. So it's important to get your recommended vaccines, yearly flu shots, and then pneumonia shots as indicated. People with diabetes should see the dentist twice a year. That answer is yes. Actually, everyone should see the dentist twice a year. But because diabetes puts you at a higher risk for developing severe infections, you need to take extra good care of your teeth because dental problems can cause some pretty severe and even life threatening infections. Frequent urination and thirst are signs of low blood sugar. And that is no. Actually, those are signs of high blood sugar, and often going to the restroom a lot more, eating a lot more, and drinking a lot more are the first signs that people actually realize that they have diabetes. A person with diabetes can eat as much as they want as long as it's sugar free. That is no. Even though the sugar is removed from many of the foods, they replace it with other